Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we have been discussing this problem of restorative dentistry, and having orthodontics is a big part of restorative dentistry, and mixing restorative dentistry. And in this particular case, we mixed restorative dentistry and the orthodontics part of it, and then also an oral surgeon played a part in this too. And it was a very interesting young man. We started out with a young fellow here who had only 19 of his 32 normal teeth in his mouth. And what would we do in this case? And what we tried to do was finagle around orthodontically and put the teeth that he had present in a place where they should be, and then he had to come back and have bridge work done on almost the whole mouth. And he also, there was some oral surgery done, not a great deal of it, but he helped that out too by expansion of the arches and everything. So let's look at this case. This started way back there. He was just a young man at that time, and now he's the sheriff here in Glen Rose, Texas. And let me show you the start out of this case right here. I'll tell it going. Let's see. Now you can look at it to start with, and you don't realize that he has only a little over half of the permanent teeth that he should have. And so let's look at the work that we did on him. And this is a young man. He was about, I don't know, 16 or so when I was working on him. And his upper arch fit inside of his lower arch. And this is similar to a restorative case that we have done earlier than here. And these little bitty teeth that are worn down like that are deciduous teeth that he still had. And so we had to come in and enlarge the upper arch. Let's see, I don't have my marking pen on here. Let me get a pen going here, and what we'll do. And so we had to enlarge the arch. The upper arch is the inside. The lower arch is going like that. And so we have to enlarge this arch. And we can enlarge the arches now. It doesn't matter. They can be 80 years old. That's about as far as I've gone. I've never jumped on a 90-year-old to start them. I've run into 90 with cases. But anyway, we can expand that arch, and we can bring this arch down to where it ought to be, and we can surgically, they spread that out for us. And then you can get rid of the deciduous teeth in there. And he was going to school at some town here south of this, and he had to come into Hearst for us to see him. And his parents brought him in all the time, and I worked with an oral surgeon and also a gentleman that was going to do all the bridge work in this case. And so we took the permanent teeth that he had and put them in place. Now here we opened the bite, we put these blocks in, and we separated the teeth out there, and then we expanded this. We put an intruding arch here, which should bring this all down and bring it level the bite out and everything. And this looks darn nearly impossible if you haven't gotten into this type of work. But you can do this, and I want you to feel that you can do this. This ought to be a part of all orthodontic people that know about taking care of this. Now, we expanded it, had to bite open like that, and we got it spread out over it. Then we had to use it, go from the front and have him bite into the pad on the front while we got these teeth over. And these teeth will move together to a great deal of the tissue, and the teeth will come together without the teeth getting bigger. And we level the bite out with a pad in the front of the mouth. And you can see that way that fit. And he had to eat that way for a good while we level the whole arch out. Then after we got it leveled out and put the teeth in the place they should be, the restorative man went in and waxed up and showed what could be done here. And we also made the laterals big, and then when they come in, they crowned the centrals, if I remember correctly, and they made them a little bigger to fill that opening gate. And this is a pretty well class 2 relation here. And on the other side of very similar. And now we took those positions where those teeth were, and they made crown preparations, and they set up artificial teeth in those places, and we put brackets on there to expand the arch at this point. Now here's the restorative man's deal. He's got these little gold crowns there, and the teeth fit over that. That's on the bottom arch, I think. And the area there is going to be filled with bridges. And so here he is later on, this is 80, 11, 8. This is later on down through the case that he has matured, and he took those, they prepared those teeth, the restorative dentistry did that. And then we got the teeth back. He put bridge work in all the mouth, all over. I mean, everything he's got is crowned. Those two centrals are crowned, and they support some of the other teeth back here. And we spread this out. 19 of these teeth in here were teeth that he had, permanent teeth, that he didn't, in other words, he has bridge work filling in all the other cracks. He didn't have extra teeth like in some of these cases. We have the wisdom teeth and the other teeth. If we'd had those back there, we'd have pulled them forward to help close the spaces that way. But here he has to have bridge work done all over like that. And so that's the way it meets. And years later, this was 1989, 11 of 89. This is the old x-ray. We started, I think, he was 19 years of age in this, where we finally got to working on this. And we took all these baby teeth out, and these are the permanent teeth he had left, and the bridge work is every crown in his body had crown on it. I think maybe possibly this tooth over here was not, but I think they crowned both of those to get support for this bridge. And this was crowned, and these teeth And that's all the teeth the man had. Let me see this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. I was mistaken. And now here he had operation on the jaw, and there's where the jaw was lengthened or shortened. Right here, you see those screws in there. That's the part the old surgeon did. He brought the jaw back some to help fill that in. And I put the teeth where they needed to go, and then the restorative man did the bridge work. So thank you for watching. Let me see if that's the end of it. And here he is with these smiling with the teeth. And I came back here to live in Glenrose several years back. In fact, we've been here nearly 30 years now. And he's still sheriff here in Glenrose. And you can see the edge of there with the little calculus formed on those teeth. And he has still got these teeth. I think he had to have something done on one of them. Now this is restorative mixed with old surgery. So the restorative man and then the orthodontics getting everything lined up. And this is where you marry or get these people lined up together to do a single case. So this is an interesting case. And I wasn't watching what I was doing one day. I was driving downtown. I was going 52 in a 45 zone, and this car pulled up behind me and the lights blinking, and I pulled over in the side of the road up there, and this guy got out and came up and looked in the window, and he said, "Do you know who I am?" And I looked at him and I realized who he was. And I said, to my misfortune, I do know who you are. And he said, "Well, I may owe you one, so slow down." And brother, I did. And he is a good sheriff for this little town here, and I appreciate his work. And he's still here. And thank you again for watching this. And this is a ultimate in mixing old surgery and restorative dentistry and orthodontics together. And that's one way I wanted us to develop the American Orthodontic Society. This is the ultimate in restorative work. Many of these cases we can just bring the back teeth. They have extra teeth and fill in the gaps, and the person has a good set of teeth then. So thanks for watching, and I'm going to hang up, and I hope you'll join our group and subscribe to it, and maybe this will give you a little encouragement of what can be done. And I want our people in this organization to realize that you can do these things yourself. Thank you, and I want to sign out.